Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional in your area.
You can contact us via Twitter at Mind Deconstruct. I'm your host, George. With me is Dr. Kaz. Dr. Kaz Nelson is an American Board of Psychiatry and Neurology certified psychiatrist, licensed to practice medicine in the state of Minnesota, and an assistant professor in the Department of Psychiatry at the University of Minnesota Medical School. On today's episode, After Trauma, your questions answered about PTSD. So, Dr. Kaz, we're on our 7th episode.
Can you believe it?
It's been a couple months, and I think we're hanging in there. We're keeping a pretty good schedule, aren't we?
I am loving talking about mental health and getting the word out about these kinds of topics. It's been a thrill to see the response and really appreciate people's engagement in the podcast.
Yeah, it's been a lot of fun. Shout out to my good friend, Brett, who thought of the original idea and kind of pitched it out to us, and we kind of ran with it.
Yeah, he said, hey, you guys should start a podcast. And that appealed to our sense of narcissism just enough to want to do it.
Yeah, totally. For our hot topic in mental health, Veterans Day was just a few days ago. There's also been some events in the news, some more mass trauma violence that recently happened down in Texas. So that's a sad issue. Any updates from your perspective, Dr. Kaz, after that latest Texas massacre?
Yeah, we just finished recording our podcast about the effects of mass violence, like what happened in Somalia and Las Vegas. And it was so disheartening and dismaying to just see this continue in the news and continue to be a current event and a hot topic. And I think we all just have this sinking feeling, wondering when the next shoe is going to drop and when this is going to happen again. It's a really scary and upsetting time.
And one of the other current events being the sexual assault and harassment that's kind of flooding the news right now, kind of powerful figures abusing their power.
Yeah, it seemed like things really kicked off with the hashtag #MeToo campaign, and there's just been this snowball of public stories and testimonies naming names and describing dates and circumstances when people were assaulted or harassed sexually, and including our Minnesota legislature. So no matter where you turn, it seems that the impacts of trauma are around us more now than ever, and it's being talked about.
Today we're going to talk about trauma and PTSD. PTSD means
post-traumatic stress disorder.
Okay, and again, we'll just say PTSD probably for the rest of the episode. Talking a little bit more about trauma, how do traumatic events affect our well-being, Dr. Kaz?
Well, George, our bodies are primed to pay attention to trauma. If it didn't, that would be kind of strange. Our bodies want to avoid and minimize the impact of trauma. And so our nervous system scans for things that are threatening and scans for things that have hurt us and really mobilizes to try to avoid or stay safe from such things in the future. It's why we've stayed alive as a species. So depending on the traumatic event and the person that it impacts, it could have little impact to one's well-being or substantial impact to the extent that it impacts every moment.
Let's talk about a little bit about that, because the same traumatic event could happen to two different people. One person could develop PTSD, the other may not.
Yeah.
Does that mean that one person is weaker than the other person?
No, absolutely not. But of course, I'm glad you brought that up, because that's what people assume, that if they've been impacted by a trauma or are struggling with it, that they're somehow not strong or that there's something in particular that's wrong with them. And that's just not accurate. Trauma impacts different people differently. It has to do with one's biology. It actually probably has to do with one's genes. It has to do with some of the things that you've learned previous to that moment and what your body and brain assumes about incidents that happen. And all of these things work together and sometimes add up to post-traumatic stress disorder. Sometimes it adds up to brief difficulty struggling after an event. And sometimes people aren't affected at all by traumatic events, depending on what happened.
What about adult versus childhood trauma? How does trauma affect children differently than it affects adults?
Well, children have nervous systems that are more vulnerable than adults in some ways. They're like little sponges picking up information. So if children experience severe trauma, early or cumulative trauma, it can leave scars and impacts on their well-being that last quite a long time. And so as psychiatrists, we do really pay a lot of attention to the timing and the intensity and whether it was a repeated or a single incident as we try to understand its impact. All of those things are going to make a difference.
So are children more likely to develop PTSD, or how does it affect the children differently than it affects the adults?
A lot of people have studied this and looked into this because it would be wonderful to understand why some children tend to do well, even though they've been in traumatic circumstances, and other children are more effective. So they've looked at gene studies and the length of your serotonin gene and all sorts of things to try to make sense of why some people are more resilient than others in the face of trauma. But certainly the cumulative nature of trauma, the intensity of trauma, the timing of trauma, all matter, and children are particularly vulnerable. That's why we even recommend that children not watch scary movies where there's violence on TV, for example, because their nervous system has a little bit more trouble differentiating something that's on TV as being not real. And for all a child's brain knows, that kind of violence is actually happening in the room with them when they see it on TV. And so things like that can actually be traumatic, even though we know that it's just TV magic or on TV. And so we need to be thinking carefully about the kinds of things our children experience and what they're exposed to.
What about for adults? Can a person form PTSD from one traumatic incident, or does it have to be repeated trauma?
No, I mean, certainly there are people who have been in severe car accidents or seen the death of a person, maybe been shot at or seen somebody be shot, for example. And even a single incident can lead to PTSD. And I can tell you a little bit about the actual symptoms of that kind of trauma.
Symptoms of trauma that would lead to PTSD, or symptoms of PTSD?
Symptoms of PTSD.
Oh, sorry. Okay, I have one more question before we get to the symptoms.
Mm-hmm.
If someone experiences trauma, are there steps they can take to avoid forming PTSD?
This has been another hot topic of discussion, because you could imagine if somebody was attacked, for instance, or severely burned or something like that, wouldn't it be wonderful if we could implement some kind of treatment right away and actually prevent somebody from getting PTSD? Sometimes we've even looked at using blood pressure pills to try to impact the nervous system so that heart rate and blood pressure are a little bit better controlled after trauma, so that the brain is less impacted by the automatic things that the nervous system does to respond to trauma.
Like you're basically telling the body, hey, you're not in a stressful situation, and trying to trick the mind into kind of following suit sort of thing?
Exactly. That's what's sort of been looked at. And that's not part of standard practice at this point. It's only been looked at in a couple of studies, but it's a very, very interesting idea. The only thing that we know at this point that helps to minimize the impact of trauma is to rapidly establish a sense of safety following trauma. So people who have been sexually assaulted, for example, if we bring them into the emergency room and treat them like a criminal and continue to traumatize them, it's more likely to have a negative impact afterwards. But if we immediately establish a safe place and a supportive place where they know that they're protected, then it tends to minimize impact later on.
That's interesting. What about booze? Is that a good idea? I mean, because you're going to trick your nervous system into relaxing.
Well, it's a double-edged sword. Yes, alcohol can relax the brain, but it also inhibits learning. So if you actually were safe following a traumatic event, but you had alcohol in your system, then your body also doesn't benefit from that learning. And so we don't recommend using alcohol as a therapeutic intervention for trauma. And in fact, there are many people who maybe did that and then later regretted it because it can have an impact on their memory or in a way that allows them to have a little bit more difficulty understanding or processing the events.
And it can certainly probably lead to alcohol abuse if you're using alcohol to self-medicate.
Yeah, anytime somebody's using alcohol as a tool to treat psychiatric symptoms, it can certainly make the problem worse over time because of the impact of alcohol on the brain itself.
Here's my favorite part, Dr. Kaz. What are the symptoms of PTSD?
Sure. Well, we came up with a handy way to remember the symptoms of PTSD. Dr. Marianne Bernardino, former resident in the program I run at the University of Minnesota to train psychiatrists, came up with the idea FIGHT, F-I-G-H-T, to remember the symptoms of PTSD. So the first F stands for flight, and that refers to what we would call some of the avoidant symptoms where people avoid things, like trying to avoid distressing memories, thoughts, or feelings about the traumatic event, or avoiding external reminders. So if you were assaulted at a grocery store, for example, somebody might actually avoid going to a grocery store to avoid prompting feelings of that trauma. The I in FIGHT stands for intrusive symptoms. Sometimes people with post-traumatic stress disorder have these very distressing dreams or memories that just kind of hop into their brain. You know, somebody might just be standing there washing dishes and all of a sudden they'll have immediate thoughts of the trauma go into their mind's eye.
Is that like the classic Vietnam flashback sort of? Is that what?
Yeah, sort of a re-experiencing of the trauma is a quite severe form of this intrusive symptom. Sometimes it can be an intrusive thought or image, but it can also be so severe as to be kind of an intrusive re-experiencing of the trauma.
What's the G?
G stands for gloomy cognitions, which is a way of talking about the negative moods or thoughts associated with the traumatic event, kind of sense of sadness or distress. H stands for hypervigilance, which is a way of saying that people have alterations in their arousal. They'll be quite irritable, maybe have angry outbursts, reckless behavior even. And then something that we see quite prominently in the clinical setting is this exaggerated startle response. So there might be somebody might drop a pencil behind them and there'll be a noise and they just jump out of their skin because they're so hypervigilant, focused on their environment around them and safety issues. And George, you probably have colleagues who were maybe on the road looking for IEDs or something like that. And now they might be back in the United States, but they see a garbage bag on the side of the road or something like that. They probably just jump out of their skin. And that's a form of hypervigilance.
Okay. And the T.
Yes, the last T stands for trauma. And part of the diagnosis for PTSD says there actually needs to be exposure to an actual or a threatened death or serious injury or sexual violence. And the diagnosis of PTSD is for when somebody's about a month out from the incident. If it's less than a month, it's considered an acute stress reaction. And
because the P would be post-traumatic.
Yes. Yep.
The trauma has to be well behind you.
Yep.
Presumably.
And yeah, some people would say, gosh, a month after a trauma is not really that long. And there's nothing really magical about that month. But a group of people sat around a table basically and came up with a month as a reasonable cutoff. But the same symptoms under that time cutoff is called acute stress disorder, and anything after that's called post-traumatic stress disorder.
And those are the diagnostic criteria for PTSD?
Yeah. And the new DSM-5, the newest version of psychiatric diagnostic diagnostic criteria added that part about the gloomy cognitions because those mood symptoms weren't necessarily incorporated in the diagnosis before. And they also classified it a little bit differently. They pulled it out of the group of disorders called anxiety disorders and created its own section for stress-related disorders, which I thought was really a step forward in giving this set of disorders its own, basically, attention and categorization.
They pulled it out of anxiety disorders
Mm-hmm.
and into stress disorders.
Yep, they created a new category called stress disorders.
Thank you, Dr. Kaz. That's great. And I understand we're going to be talking more about PTSD in a later episode, getting more into the available treatments for PTSD. So stay tuned for that episode. Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter at Mind Deconstruct.